Start.
Hello, Michael. I'm Dr. Ibrahim, one of the psychiatrists here today. I
Uh,
understand the GP is concerned about you and has asked me to see you.
it is just some sort of misunderstanding. I was discussing with him some things
Mm,
which I believe in the Christianity, but he didn't understand what I'm saying. He said that I must talk with you. That's it.
okay, right. So it has to do with your religion. So what
Yes.
exactly did you discuss with him?
Well, the issue started by I noticed that on the test tube there is a 666 number. So
Mm,
this opened the discussion about the 666 and satanic signs and the evil things
okay.
which are happening here and there, and there are a lot of satanic issues going on. And this is the word of God, as mentioned the Bible and so on. I don't think
Mm,
that he understood me, what I was saying.
okay. Yeah. So you did from what you said, it does seem it holds a specific meaning, the 666 and the satanic thing. And I also did get from the notes that you think it may be a
Well,
conspiracy of sorts.
well, I go to the church regularly. My father was a
Mm,
priest, and it's common belief in the church, and everyone in the church, I
oh,
guess, is having this
okay.
same belief.
Okay. It's a common belief in the church.
Yeah.
Right. So I do understand that you were supposed to have a blood test, and because of this 666, it seems to be an
Yeah.
issue.
Yeah.
Mm, right. And what if I'm just wondering if we could change the tubes? Is it something you'd be open to having?
Well, I didn't have any problem regarding this test tube, actually, except that I said that I
Okay.
would prefer if there is another test tube. Maybe that's why he was a bit worried about what I'm saying. But if he said that no problem, I think don't have any problem to put my blood in this test tube as long as the results will be okay.
Okay. Okay. Right. So you'd be open to having your test done in the tubes. Is that what you're saying?
Yeah.
Okay. Right. And I also hear you did say that the members of your church believe strongly in the same belief. Am I right?
Yes.
Right. So, Michael, I'm just going to be asking you a few questions just to be sure what we're dealing with. And these are just routine questions we ask everybody in the clinic. Would that be okay?
Okay.
Right. Sometimes, Michael, you hear people talking when there's no one
No, no,
around
no,
you?
no. I'm not crazy. I don't hear anything. No.
Mm, I'm sorry, I'm not
I've
trying.
just elaborated my faith in Christianity. And this is something which
Mm,
I don't think put me in this place of being asked about hearing things, and this is not the best way to have the
okay.
discussion.
Right. Just as I said, they're just routine questions just to, be sure that we're not missing anything. Okay.
Okay.
So just aside hearing things, do you find any change in your taste or smell?
No, no.
Okay, right. And I'm just going to ask, sometimes, Michael, do you think people are maybe out to harm you in any way?
No, why? I'm a peaceful man. I go to church, and actually, I have a lot of
Mm,
charity activities.
okay, right. And I understand you have a lot of charity activities. Do you sometimes feel special in some way?
No, no, man. Not because I'm special. I know that if I did something good, I will be more closer to the God. If you want to say this, it's okay. But I'm special. No.
Mm, okay, okay, right, right. That's good to know. And do you have any concerns about your health at the moment?
What is I want that too because I have these repeated headaches, which are not very comforted by the painkillers. So I wanted to know what's going on. Maybe there is undergoing medical problem or high blood pressure. I don't know. That's why I went to the GP.
Okay, okay. And have you had anything for these headaches?
Well, I tried painkillers, but it didn't work.
Okay, and what did the GP say about it?
Well, actually, he didn't give me a chance. He said that I must talk with you before having any service from his clinic.
Okay. And aside these headaches, do you have any other physical health concerns, say hypertension, diabetes?
Or maybe, I don't know actually. Maybe I have diabetes, maybe I have blood pressure. I don't know.
Oh, okay, okay, right. So would assess you further to see that we're not missing anything. And Mr. Michael, have you ever had to see a psychiatrist before now?
No, no.
Okay, right. And would I just ask in the family, is there anybody with a similar, as I know you did mention that in the church you have these beliefs, but in the family, do they share the same belief with you?
Yes.
Okay, right. And so I understand this is quite a difficult time, and in difficult times, sometimes people may think about harming themselves. Has it crossed your mind before?
No, no, no. Why should I do this? This will not please
Mm-hmm.
God. 1 minute remaining.
Okay. And just routine questions again, Mr. Michael. Do you take alcohol to help manage stress?
No, no. It's not something which I prefer. I follow the
Okay,
word of
how
God.
about okay, right. Sorry for asking. And how about use of any street drugs?
No, no.
And has this impacted your mood in any way?
My way is fine. Only that I'm
You
not
see,
very happy to
that's
be put in this situation.
okay. So from what we've discussed, Mr. Michael, it does seem to me you've got an overvalued idea about the 666 barcode. However, I'm happy to arrange another meeting to discuss more about this and see how best support you at this time.
Okay, very good. Very, very good. So how do you feel about what you did? Give
Um,
me your impression and please give him some feedback in the chat section. This will be very helpful for all of us.
okay. Yeah, I think I initially
Okay,
tried to um, just find out some more about the idea. I tried to shake it as a form of a delusion. And I did try to rule out if there's any psychotic
good.
thing ongoing, but I didn't think I delved into things like thought interference. But yeah,
Good,
I'm open
but
to the feedback.
everything,
Yeah.
yeah, it was very organized. I liked your vibes. I liked your attitude. You have good communication skills, very calm. But you can do a little bit better if you understand how to approach the asking or the interrogation about the mental state issues regarding the hallucination psychosis. It's not very good to ask someone to hear voices, even if you said that I'm going to ask you routine questions. There is another better way, which we call weaving. You should put the patient's experience in your question. For example, so I'm wondering, well, have you ever had any experience with the Satan or demons, like hearing the voice of Satan, or
Mm,
have you ever had this experience? So you start to incorporate the patient's experience or the issue which you are discussing with the patient in your question. This is called weaving. If you just go, do you hear voices? Do you see things? You might get a bad question style in the feedback. We don't want this. Okay. Your introduction was good, except that I know that it is written in the notes out there that I'm going to ask you written questions, and you start asking him, do you see things, do you hear voices, and you just this will be a checklisty and feedback and bad questioning style. You can have a discussion, a dialogue with him by putting what you are discussing with him in your question. So the issue is about demons and devils and satans. It will be very easy if you can put this information in your question and you phrase the question according to this. Now, having said this, we said that you'd have two scenarios, either the overvalued ideas like this one, or in which there is a pure psychotic patient. And as you can see, the overvalued ideas are negotiable. In the other case, the patient will be very defensive. He does not accept any other point of view. He has these ideas firmly, morbidly fixed in his mind. Okay, and the patient's life is circumscribed, and it's all about these morbid ideas. So you'll find him always preoccupied by these delusions, and he's deteriorating in all aspects of his life. Okay, and his ideas are not related to his culture or subculture. So you will not find him a very religious person. Maybe he has joined the church for a few months, which is a very short period for this very strong belief, or very which is not going along with his history in devotion to what he started regarding the going to the church. So going through the main items of the mental state. So you must remember that when you do mental state, there are points which you should cover. Your introduction, okay? You must have a very good introduction. It gives a very good impression about you. Do not underestimate it. And there is a simple rule for introduction. Identify yourself, greet the patient by his name, and explain why you are talking with him. And though this is a very simple rule, but many candidates not know how to do it. They mess up with this rule of identifying themselves and greeting the patient with his name and explaining why you are talking with him. You don't need to repeat what you have read in the door of the station. Just simply say that I'm talking with you because the GP has referred you to me. Is it okay for you to discuss this? And that's it. The next point in which you should pay attention, and this is usually missed by the candidate, that you should comment on the general profile of the patient, particularly if he's depressed and he's looking sad, looking downward, or he's hyperactive like a manic person who is jumping here and there. So there will be a particular attitude of the patient in front of you, a particular profile. You should comment on it because this is how you comment on the general part of the mental state. And also the speech, particularly if he's manic, he will speak fast or slow if he's depressed. Then the psychosis, as we said, then the mood. And according to the scenario, you will either focus on the psychosis or the mood. You don't have time to do both, okay? Cognition is important if the patient is having a mood problem or if he is an elderly patient. If you miss this point, the point of cognition, if the patient is elderly or the patient is having a mood problem, most probably a point will be deducted from you. Another point which the candidates forget to ask about is that the coping and risk is part of the mental state. Coping and risk is part of the mental state of the patient. Okay, so how does he cope with the stress he's in and the impact of all what has happened of what happened on his life? And from this you open the door to how does he cope with this, and you assess the risk. This is a very important point. I don't think that anyone will pass from the CASC if he does not show that he is a safe practitioner and he is keen to assess the risk in any patient. Okay, this is the rule. Now, your introduction was good. You start the conversation after the introduction by taking the complaint, and there is a simple rule for the complaint in which you ask about the onset and the course and what happened before the onset. Many candidates argue that this is part of history. Well, there are no clear-cut lines, and you must have a structure for your dialogue. What are you going to say when you talk with the patient? Are you just going to introduce yourself and go and ask him, do you hear voices? Do you see things? Or you are going to have a structured dialogue, knowing particularly the complaint and what has happened and the onset, course, duration, what happened before the onset, and then a picture will be clear for you whether this is a psychotic problem or a mood problem. Then you start to take the psychosis or the mood elements which you should assess. there is an acronym for the psychosis. I guess you covered everything, the persecution, the perception. I don't think that you covered the broadcasting, thought insertion, and withdrawal, or the control. You only cover the persecution and the perception, and this is a mistake. This is a problem which can be psychotic. So you should cover the psychosis in depth. You did not ask me anything about the control, you don't, or thought insertion or withdrawal. You sufficed only by the persecution and perception. You ask about the mood, though your screening question were not very clear. Okay, so how was your mood in the past 2 weeks? I'm wondering if there is any guilt feelings. Okay, they are very keen to ask about the guilt feelings. I don't know, though it's not written in the nosology, but for them, guilt is another point which you should assess when you are asking about the mood. Okay, and the anhedonia. So you ask about the mood, guilt, and anhedonia. This is how you screen for the mood and definitely the vegetative symptoms like sleep and appetite. As I said, cognition is important only in the mood stations and the elderly. If you missed it in a station in which there is no one of them, there is no problem. Impact, coping, and risk you ask about. Insight, well, there is no insight here because this man is already okay. And termination, your termination is good. Okay. It is a very interesting topic how to distinguish between the overvalid ideas and the delusions, because you are going to encounter this in your clinic. You must know how to differentiate, and sometimes it is not easy, particularly if you are dealing with another culture. Okay, and here you have some nice visual materials which can help you to differentiate. So I hope that you found it helpful, doctor. Okay, very good, but pay attention to my feedback and let's see the feedback of our colleagues, if anyone. He asked
Okay.
about
Thank
family
you.
history. No, actually, family history is not a point to be asked about in the psychosis. Maybe he can ask if this patient has been in contact with psychiatric service. But asking about the family history is not important in a mental state examination. Okay. Thank you, Dr. Ibrahim. Who would like to go next?
Thank you. Thank you for the feedback, Dr. Hussain.
Thank you, Reed. Thank you, Reed. Okay. Who would like to go next?
I'm just wondering if Dr. Ibrahim would like to do barcode psychosis, and in that way it will be a practice for him
Well, I
to.
have no problem, but the candidates who have booked the stations and I'm wondering where are they? Ibrahim is the only one who showed up. I thought that we will have at least 3 candidates ready to do the stations. If you want, it is not there, it's not available. If you want to do it, brother, no problem. There is no one there to do it.
Sorry. I'm happy to do it if there's no one.
What?
And I just heard her say something. I said I'm happy to do it if there's no one to take the station.
If you are happy to do it, you want to do the same station but a psychotic patient?
Oh, well, what I mean is if there's nobody to take the station, I'm happy to do it.
Well, actually, there is no one in the this Google Sheet. Nobody has booked it. I cannot see anyone who has booked. Okay, are you with me? I don't know. So
Yes,
until Dr. Ibrahim makes it up his mind, are you ready
I've
to
made
do
up
it?
my mind, Dr. Hussain.
Okay, ready to do the next station? Okay, we'll
Yeah.
share this barcode on which they will have a psychotic patient. What is this? Ready?
Yes, I'm ready.
Okay, great. One,
Hello,
two, three, go.
hello. I'm Dr. Ibrahim, one of the psychiatrists here. What may I call you?
You can call me Michael.
Oh, Michael. I've been asked by the GP to have a discussion with you because he's quite concerned about you.
Well, I'm not happy being here, doctor. I didn't do anything, and I'm not crazy to be here. I don't know why did
Hmm.
he refer me and say that I will not take any service from this clinic except if I talk with you.
Oh, I see you're upset about what has happened, and I'm here to just see how to best support you, if that's okay.
Okay.
Right, right. Can you tell me a bit more about this?
Well, the issue is that I told him that I will not put my blood in a test tube with a satanic evil code in it because there are
Hmm.
satanic rituals which are done by those who are evil using the innocent people's blood. Okay, so I said I
Hmm.
will not be part of it. Don't put my blood in this test tube. He said that
Oh,
my name is already there with a barcode. I said I totally refuse. So he said I will stop with you.
right, right. I also did read from the notes that are you referring to the 666 barcode?
Well, I don't know your religious background, but this is a satanic code. It is written in the Bible.
Oh,
As you can see, I have a Bible in my hand. I follow the word of God. Okay,
mm,
so
mm,
this is a clear sign, a clear code that this is an evil thing. Okay, this is a message
okay,
from God. I should not put my blood in this test tube.
right. And Miss Michael, I'm just wondering, have you shared this with anyone?
Well, I don't need to share this with anyone. I already know it. It is written in the Bible. I don't need
Oh,
more to be justified from anyone. Okay, it is written in the
okay.
Bible. The priest has talked about it. I totally believe in it, and since I follow the word of God, I can get these messages. There are codes everywhere which
Mm.
can tell me what is evil and what is good.
Oh, you did mention that you get messages. How do you get these messages, if I may ask?
By these codes. Okay, so if
Oh,
there is an evil code, so this means that
mm,
I should stop. I should not go there. Okay.
okay, okay. And do these messages get to you in any other way aside this barcode?
No, particularly mainly by numbers. I can see these messages everywhere, and I follow
Okay,
these messages.
okay. I'm just wondering, Michael, could there be an explanation to what you believe with regards to this barcode?
Well, no other explanation except that there is a God up there, and He is sending messages to the followers to help them to avoid the evil of the Satan. But people must follow
Okay,
the word of God. I have it in my hand.
okay. Right. I'm just wondering, this 666 could it be just a number, not really anything that has to do,
Well, yes,
with
it's number,
the
but
devil.
there is something behind this number. Well, everything it
Okay,
has its own meaning, but you must put it in the context. Okay, so
right,
when there are
right,
numbers, particular sequence, this has a meaning.
right. And this meaning, it means just as you mentioned earlier, the 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 devil.
Yeah, exactly.
Okay, okay, right. So you did mention about may I just ask, do you sometimes feel special in some way?
Well, not special, but
Hmm.
because I am in close contact with God, I think I
Oh,
had this message from God. It's just
okay,
a message given to those who follow His word, not because I'm special.
okay, okay, right. So this message from God, do you hear him speak to you?
No, no, no,
Okay. And just a few questions. Do you sometimes see him when there's no one around?
no, no, no.
Okay. There's sometimes I know you did say that God communicates with you. Do you have any changes in your taste or that you think, God may be
No,
having an influence on it?
no, no, no.
Okay, right. And yeah, you did mention about this message is coming to you from God. And you did mention that you're not special, but do you sometimes feel people may be out to harm you in any way?
Well, definitely yes, because these evil people who follow the Satan don't want me
Oh,
to uncover these codes, which help me to understand what's going on. Okay,
oh,
so
um,
I think they try to put something in my mind. That's why I have these headaches. That's why I go to the doctor.
oh, I'm sorry to hear that. They try to put these things into your mind. Do they try to remove your thoughts from your mind? These
Well,
people.
no, they want to stop me. They want to block my ability to uncover and pick up the God's messages.
Okay, okay. Um, Michael, do you sometimes feel controlled in any way?
They won't, but as long as I have this in my hand, the Bible in my hand, nobody can control me.
Okay, right. With all this going on, Michael, how has this affected your mood, if I may ask?
My mood is good.
Are you sleeping okay?
Yes,
Are you eating okay?
yes, yes.
Right. So I'm just going to ask a few questions, and these are questions we ask everybody. Okay.
1 minute remaining.
Are you able to tell me where you are at the moment?
What?
Are you able to tell me where you are at the moment?
Well, I'm in the hospital.
Mm. I understand this has been distressing for you, and in distressing times, people may think about harming themselves. Has it crossed your mind before?
No, no.
Mm. So with this all that's going on, what do you think? Is there a possibility that it may have something to do with your mental health?
No, I don't have any mental health problem. I'm totally fine though.
Okay, right. So from what you discussed with me, it does seem to me that you have this strong belief that the 666 on the barcode
1
may
minute.
have an influence on the devil. And so I'll speak with my team. I'll be back to inform you of our decision and see how we can best support you.
Okay, how do you feel about what you did? Fine. It was good, but pay attention to the feedback, which I'm going to tell you. During the
Okay.
general, you did pay attention to my general attitude. As you can see in this station, the patient would not be happy that he is there. He'll be defensive. Don't be defensive. Also, just try to calm him, to understand what's going on, and to help him to understand that you are there to help him, uh, and and comment on him being angry or not comfortable with this conversation, because this is part of your mental state assessment. Now, I told you several times that I have a Bible in my hand. In this particular station, you will have a man who is moving around and having a Bible in his hand, and this is something also we should comment on, because maybe in Arabic culture we have Quran, and usually you see people have Quran in their hand and they read in it whenever they have the chance. This is not the case in England. So if someone is moving around with a Bible in his hand always, this is something which you should comment on. Okay. Um, when I said to you, I have, if you wanted to check the auditory hallucinations, well, it would have been better if you also included, if he had ever heard the voice of Satan. You only ask about the God. So you just ask in general. So I'm wondering, so if you had any experience with the Satan, like hearing the voice of Satan, what about hearing the voice of God? So in general, have you ever had this experience of hearing something which no one else could hear? So this is how you ask about the auditory hallucination. As you can see, it is more palatable than us saying that I'm going to ask you some routine questions. Have you ever heard something which no one else can hear? Okay. Um, I said to you that I have a chip in my in my mind. You should have elaborated more whether this chip is causing for him any problem, if there is any control over his mind because of this chip. Again, doctor, please, the mood is how you assess the mood. As I said, how was your mood in the past 2 weeks? Not how was your mood? How is your mood is not good, because there is a duration by which we can consider that which helps us to consider whether this is a depression or not. Number two, the anhedonia, if he is still interested in things in which he likes to do. Okay. And also, they are very keen to ask about the guilt feelings. So let's say that mood in the past 2 weeks, guilt feelings and anhedonia, which is interest in the things which he used to like. Okay. Your question about the cognition is not good, doctor. Don't screen the cognition by asking him, do you know where are you? Simply, if you want to ask him, so, well, with all this going on, you feel that you are more forgetful than before. So memory, what about your concentration? So memory and concentration is enough to show the examiner that you checked the cognition, not saying, do you know where are you? This means that you suspecting that he is confused. Okay, this man is not confused. Insight. So you asked about the insight. Well, I don't know. There is a better way if you feel that there are tricks played by your mind, not saying that there's a mental health problem, tricks played by your mind. This I believe I prefer this. If you want to show that you are checking the insight, ask the role player, do you think that what you're going through could be tricks played by your mind? I think this is more palatable than do you think that you are passing through a mental health problem? Okay. Now, at the end, show that you paid attention that this man elaborated two major psychotic symptoms. He has these beliefs, the delusions, and also he has a belief that he has a chip in his mind. Okay, if you want to conclude and say that I understand that you have these strong beliefs about the 666 and satanic issues, and also you believe that there is a chip in your mind, I will discuss this with the team and I will raise my report to the GP. I hope that I can see you again. That's it. And you don't need to say anything more. Did you ask about the use in street drugs and alcohol? I think you.
I don't
No,
think I
you did
asked,
not. No, you did not.
but
Coping, yes.
anyway,
Thank you, Dr. Intisar. Yes, he should have asked about how the coping. Yeah, impact, coping, and risk in this patient. If you ask him how did this affect his life, you will find that his whole life is totally directed by these messages which he is getting from the barcodes which he is reading here and there. So it's all about these barcodes. It is totally different from the first man. So this is his impact on his life. And you should ask about the coping, whether he is coping with this stress which he might get if he encountered a satanic sign, okay, whether he's taking drugs or alcohol. Okay, and finally, ask him if there is any thoughts of harming himself and so on. So thank you, Dr. Intisar. Yes, he should have asked about the impact, coping, and risk, and this is a major mistake. Okay, thank you so much. So
thank you,
I
Dr.
hope
Hassam.
that you found it helpful. Who would like to go next?
Dr. Hassam, can I ask a question before we go to the next station?
Yes.
For this station, should I ask about the onset and duration and ask what happened before to scanning for delusion and mood and like this?
Yes. It would have been better, yes. And actually we had time. And it will be a more professional start of this conversation if you want to know exactly when did he start to have these new perspectives and these beliefs and whether and how it is progressing. Does he feel that he is seeing these codes more and more here and there? Okay, and how was he doing before the onset? And all this makes it more professional. Actually, it helps you to pick up the tricks of the Royal College because they always put something in the area before the onset in order to see who are the candidates who are clever enough to pick the predisposing and precipitating factors. Yes, you're right. If there has been anything they put in the scenario regarding the predisposing and precipitating factors, Dr. Ibrahim did not ask about this area, so he might have missed them. Thank you so much. Yes, you're right.
Okay, thank you.
Okay, thank you so much. So who would like to go next?
I can do it.
Okay, doctor. So,
Postnatal depression, postnatal psychosis, I think.
postnatal psychosis. Okay. What is your name, doctor, please?
Nama.
Yeah.
Postnatal depression, not psychosis, sorry. Depression.
Okay.
Yeah.
Okay. So we will put it on the screen. Postnatal depression, isn't it?
Yes.
Yes. Okay, ready?
Yes, I'm
No.
ready.
Okay.
What's your name? Sorry.
Let's say that my name is Mrs. White.
Mrs. White. Okay.
Okay. We'll start the timer. 1, 2, 3, go.
Hello, Mrs. White. I'm Dr. Yusuf. I'm an orthopsychiatrist here. I understand from your GP referral you've been having a really difficult time lately, and I'm here to
Yeah.
understand how we can help you today.
Okay.
What's been happening, if that's all right?
I'm not feeling good. I discussed everything with my GP, said that I must talk with you.
Mm. And when you say I'm not feeling good, what do you mean by that?
I don't know, doctor. I feel so low most of the time. I'm not able to take care of my baby, and I feel that I'm losing weight.
Mm.
But I'm not happy as before. I'm supposed to be happy with the baby. I'm not.
Yeah, I can see you look really sad and down. And when did that start?
Well, 7 months ago, doctor. Since
Some,
I've been since 7 months.
okay. Is that when you had your baby?
Yeah, I don't know if it is in relation after a few weeks from his delivery.
Right, okay. And how were you before that?
Well, everything was fine. I was happy that I'm going to have a baby, and this is my first baby actually. But after
Mm,
delivery, I'm not happy.
right, okay. And how have you been managing then if you're feeling, this low and not
I
motivated?
don't know what to do actually, and I'm worried that I'm not able to take care of my baby, and he might suffer with me.
Gosh. Is there anyone supporting you at home?
Well, I have my husband, but he's not there always because he's working in another city.
Hmm. Okay. And have you been sleeping? How's your sleep?
Well, my sleep is not good. I wake up early in the morning crying. I don't know why. I
Hmm.
just hope that I don't start my day. You understand what I'm
Right.
saying?
Yeah, and you mentioned you've been losing weight and not eating well.
Yeah.
And how's your energy been?
Well, I can't do anything, doctor. I cannot care of myself as before, or even the baby, or take care of the house. It's messed up, upside down.
Um, okay. Have you been enjoying any of the things that you used to enjoy?
No, no, not at all. No.
No, no. And you mentioned that you're not able to look after your baby. Is that the feeding that you're not able to look after, or what is it
Well,
exactly?
feeding him, carrying him when he's crying, I just leave him cry. I'm not able to take care of him and carry him. Sometimes
Okay.
also I don't change his diapers. I don't have the energy to do so.
All right. Has he ever developed nappy rashes because
No,
of that?
no, no, no.
All right. Has he been losing any weight?
Well, up till now, no, but I don't want this to happen.
All right. Okay. And how did that make you feel? Have you been having any guilt thoughts or
Well, I feel that,
worthlessness?
no, well, definitely, I feel that I'm guilty because I'm not able to take care of my baby. I'm not able to take care of my husband and my house. Well,
Hmm.
I feel that I'm a bad mother, bad wife, bad person.
Yeah. Oh dear. Yeah. I can see it's really impacting you. How have you been coping then?
Well, I don't know what to do, doctor. I don't know what to do, actually.
Have you been drinking alcohol to cope with these thoughts?
No, no, no,
What about any drugs?
no, doctor, no.
All right. Did it get to the point that you feel life is not worth living anymore?
Well, I have these thoughts that life cannot continue like this, but I don't have any plans. It's just, one can live with all this sadness.
Okay. Any thoughts about the baby related to the baby?
I'm just worried about him. That's it.
Okay. You know, Mrs. White, when people are really stressed and down, they might start, hearing voices or experiencing strange experiences. Has that happened to you?
Well, I have to pause. Sometimes I hear my husband's voice, though he's in another city, saying that you are a lousy bitch,
Hmm.
you are worthless. I know that he's not here, but I can hear this voice sometimes, not always.
Okay. Is that the only voice you hear?
Yeah,
Okay. Does this voice ever command you?
no, I'm
No.
just
Does it
saying bad
comment?
words. Just saying
Yeah.
bad words.
Right. Okay. That must be really distressing then. Does it ever is it clear as my voice? Do you
We're
hear
just
it?
whispering, just not as clear as I'm whispering.
Right. Okay. What about seeing things that are not there?
No, no, I've never seen anything that's not there. This is
All right.
last thing.
Do you All right. Mrs. White, do you ever feel people can control your thoughts?
No, no, no,
All right. Okay. What about people hearing your thoughts?
no, no,
Okay. Do you think anyone is out to get you?
no, not at all.
No.
No,
Or the baby, harm the baby?
no,
All right. Okay. Mrs. White, is this the first time you see a psychiatrist?
no. I've been in contact with mental health services before.
Hmm. What happened there? Were you
One
on
minute.
medication?
I used to have depression, but has been controlled for about 5 years. So I
Hmm.
discussed this with my doctor, said I can stop the medications and get pregnant. Everything
Hmm.
was fine until just 7 months ago.
Okay. Right. Okay. Do you think this is could be related to another episode of depression?
I don't know. I don't know.
All right. Well, thank you so much for speaking to me. I'm really worried about you, and it seems this is a relapse of depression. And I would like to arrange another session to discuss with you management plan, if that's all right with you.
Excellent, excellent. The only thing which you should pay attention to that there's a particular psychosis which is associated with the depression, which is nihilistic delusions. If you just mention this will put a cherry on top of your perfect performance. Very good, very, very good. I don't have any comment actually. You covered everything. Your dialogue was very good, very professional, very empathetic. You did not miss any cues. I don't have any comment except that you should have mentioned the nihilistic delusion, particularly that you felt that there could be psychosis underlying this mood, this low mood. Okay,
Mhm.
excellent. Doctor. I don't have any comment. If there is anyone who has any comment, please put it in the chat section.
Thank you, Doctor.
Okay, thank you so much, Doctor. As you can see, this is a very good performance as regard what I'm interested or how I assess the mental state, and this is how also the candidates who performed like this, according to my experience, did help this them to pass. Okay, very good. So who would like to go next? We have 5 stations. Anyone would like to do this station?
Hello, can you hear me?
Yes.
Okay, I'm Dr. Mahvesh, and I signed up for prodromal psychosis, so I would like to do that.
What station, doctor?
It was prodromal psychosis, the
Prodromal
last one.
Yeah, prodromal.
Yeah. Okay, can we start?
Okay. Yeah, talking to the mother of, talking to person who is, his name is, let's say my name is Robin. 1, 2, 3, go.
Okay. Hello, Robin. I'm Dr. Mahvesh, one of the psychiatrists. How are you?
Well, I'm fine. I'm fine.
Okay, okay. So we are here because your mother is concerned about you, as she's saying that you have left work suddenly. So what is going on, Robin? Can you tell me about that?
No, I'm not happy with the work. I don't think that I fit among this team. You know, not everyone can join any team. I don't think that they don't want me. So I left.
Okay, so you thought that they don't want you. Uh, was there any event or any such situation which led this you leaving
Well,
work, which led you to
I think
leave
they
your
keep hinting about me, and I feel that they don't want me among them, and they keep, sending messages to me by many ways. So that's why I decided to leave.
Okay, that sounds to be a very uneasy situation. But can you tell me for how long has this been going on at work?
Well, it started 3 months ago, doctor. I felt that there's
3 months.
something,
All
yeah.
right. Okay, so since 3 months you were like in the situation where you thought that you were unwanted and people around you
Yeah,
are not like liking you and they are
yeah.
just cueing you to leave the work. Okay, anything else? Any other experience you were having in these 3 months? Like were they talking about you? Were they trying to harm you in
Well,
any
actually,
kind?
they don't talk. They have
Something
this
about that?
particular way of communicating with each others by the way they do, they move their hands, and the way they touch their hair, the way they shake their hands. And they just comment on me
Okay,
and pass notes to each other about me by this way.
okay. So actually they were not having a proper dialogue, but they were kind of using sign language, you're saying, right?
Yes, yes.
Okay, okay, Robin, can you tell me that have you ever heard voices when no one is around?
I'm
As
not
if that you're
crazy.
hearing voices when no one's
I'm
actually around.
not crazy.
I understand it. I understand. I know my question does make you feel uneasy. I'm sorry for that. Okay, tell me that how have you been coping with such a stress in 3 months?
Well, I couldn't cope with this, doctor. I decided to leave
Okay.
this place and go home and avoid any communication with any one of them because I'm a peaceful man and they don't want me among their team.
Okay. Okay. Wait, so can I say that your social life has affected since few
Yeah.
months?
Well,
Not just the work, but in your personal life. Can you tell me about that? In your personal life, how
yeah.
has that affected?
After leaving the work, I prefer to stay at home. I don't want to to be involved with anyone, I don't want to feel this feeling that not being wanted anymore.
Sorry, David, I can't hear you.
I don't want to have this feeling of not being wanted anymore, so I just avoid being in contact with anyone. Hello? 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 I think, well,
Yeah, there was a distortion for a few seconds. Sorry for that.
no,
Okay, Robin, just continue. Okay, Robin, can you tell me that any unusual experience you're having around, like something
like,
out of the blue, something is
no,
bothering you?
no,
Okay.
no,
And have you ever felt that your thoughts are not private? Have you ever felt that kind of thing?
no.
Okay, okay. Can you tell me more about um, your the way you're coping? You're saying, how have you been sleeping?
Well, as I said, I prefer just to avoid in contact with anyone because I don't want to have this feeling of being, you know, abandoned, or don't want to feel that being rejected from anyone. So I just prefer to stay at home after leaving the work.
Okay, okay. Um, Let me ask you, are you comfortable at home? Or is there some things bothering you at home as well?
No, no, at home there is no problem. I don't have it.
Okay, you're totally comfortable. Are you eating well?
Yes,
Okay, and what about your sleep?
my sleep is good.
Okay. Um, have you ever felt that there is something controlling you, or your actions are like out of the blue, they're not your own?
No, no.
Okay. So how do you spend time at home? I mean, is there any particular thing you're up to?
No, I just stay at home in my bed and I listen to music.
Okay. Okay. And can you tell me, have you been using any alcohol or drugs?
No, no, no.
Okay. Let me ask you, Robin, is this the first time you're talking to a psychiatrist?
Yes.
Okay. Okay. And I would like to know more about any big changes in your life
One
which
minute
has
remaining.
happened in last few months. Okay.
What?
Any big changes in your life, like for example, like shifting houses or anything like
No,
that,
no,
since last
no,
few months? Okay.
no.
And has your family been supportive?
Yes.
You live, you're leaving the job. So how are you managing financially right now?
I don't care. I don't have any expenses.
Okay, okay. And have you been having any problem with the memory, like forgetting small things or something like that?
No,
Okay. Or do you ever feel confused sometimes during a task or during, you say you are
no,
listening to music. So sometimes do you phase out or zone out when you are in the moment
no, no, no.
doing something? Okay, okay. Okay, Mr. Robin, what I gather is that you have left because you were not feeling comfortable around your colleagues. They were uh, giving you
Time. How
cues
do you
to
feel?
leave.
Time.
Okay.
How do you feel about what you did?
Well, I was kind of here and there. It was not that structured as I
Yes,
intended it
yes.
to be.
Unfortunately, you will have a very big feedback that you are not organized. You are checking the
Okay,
psychosis and one element of the mood. You go back to the psychosis and then you check the mood and you put
okay,
one element of psychosis among the mood. It was totally disorganized. Again, doctor, please
okay,
don't say, do you hear voices? You just make it be ready with a more palatable way, other than I'm going to ask you so you know that your questions are not that good. And saying that I'm going to ask you some bad questions does not make them good. So you can see that I
okay,
understand that you have been through a lot of stress. I'm wondering sometimes stress can bring strange experiences like hearing voices when no one is around. This is more palatable and it's more related to stress.
okay,
other than saying, I'm going to ask you some routine questions. I hope that you are not offended by them. So you understand that your questions are offending. So why do you ask this type of questions? Okay. Again, doctors, when you ask about the mood, it must be a very professional way of assessing the mood. Okay, how do you feel in your mood? Okay, it's not enough. Okay, how was your mood in the past 2 weeks? Because 1 day of low mood, 2 days of low mood does not make a depression. Okay, but we have a clear cut of 2 weeks. So how was in your mood in the 2 weeks, the past 2 weeks? I wonder if there's any guilt feelings. Okay, so are you still interested in the things you like to do? Ask these questions. You screen the depression by the mood, guilt, and the anhedonia. Again, doctor, any changes in your life, if the family is supportive, finances, all these are deviations from the mental state examination.
Okay.
These are not questions related to the mental state. These are historical questions, social issues, but not mental state. You did not ask me about the insight at all. You did not assess the insight. Did not assess the insight.
All right.
Okay, so let's see I know that you have feedback. You can personalize more. Iman is saying a very good feedback. Have a look at her feedback in the chat section. And let's have a look at this. Okay, let's have a look at the.
Get that.
Okay, so in this station also you might have someone who is defensive, not happy that his mother is referring him to a psychiatrist. So be ready to comment on this. As I said, always, when you start your station, you will see a patient with an attitude, a profile in front of you. They bring for you a role player for a reason. They want to see if you have the appropriate reciprocal emotional approach, if you are able to pay attention to what the patient is doing, if you are able just to have this communication with the patient, not focusing on a set of questions in your mind. So if you see an angry patient, comment on it. If you see a depressed patient and he's looking sad, comment on it. If you see someone who's jumping and active, comment on it, okay? In this patient, you might have someone who's angry, not happy talking with you, comment on it. Though I did not demonstrate this, but you should expect this. Okay? Onset, you ask about it. I expect the stream to ask if it is it is more and more. Okay? Okay, which is the course, and it is very important to ask a question about. So I understand that it all started 3 months ago, that you started to pay attention to what your colleagues are doing at work. So I'm wondering, how were you doing before that? If you ask this question, you will pick up the Royal College trick that they say here, that he started feeling muddled. Okay, this is a delusional mood. Okay, you see, doctors, this is a very good example of the tricks which the Royal College put. So nobody wakes up with a psychotic experience. So there is some sort of delusional mood, and when he started to pay attention to their head movement, everything made sense. Okay, so after taking the complaint, it is very clear that this is a problem of psychosis. Assess the psychosis and assess it in depth before shifting to the mood. Unfortunately, this is something which you did not do. You were jumping from this topic to the other topic. So PPBIC is my acronym for assessing the psychosis: perception, persecution, broadcasting, thought, insertion, and control. Very good if you ask all these points. This definitely will be considered that you ask in depth. And as I said, the screening questions for the mood, pay attention to them. I did not write here the guilt feelings, but they like those who ask about guilt feelings. Cognition is not very important if the case is not an elderly or not mood. Impact, coping, and risk. You asked about insight. You did not ask about termination, unfortunately, it was not organized. And most probably, if the performance is not organized, mostly you will not be able to finish in 7 minutes. These are very subtle fine-tuning in your performance. If you paid attention to them, I feel that you can do this station very good in the 7 minutes frame. Thank you so much. Who would like to go next?
Hi, doctor. Could you hear me?
Okay, so what is your...
Hi, I'm Dr. Chong.
I can hardly hear you, doctor.
Oh,
Your voice is very low.
Maybe it's my ear headphone that is having
Yeah.
some problem. Is it better now?
Yeah,
Or
yeah,
is
this is better. Yeah. So what
Okay.
is your station, Dr. Chong?
I'm doing the mania in 16 years old.
So can you, if you want to put your cam off, no problem, but having a face-to-face conversation will help you to be immunized from the stress of the exam. But it's up to you. I
I'm
respect your
sorry,
preference.
because my computer does not have a camera, so I
Okay.
can't turn.
Okay, so this is the menu of the 6C. Then I'm ready, doctor, whenever you're ready.
Okay, sure.
Okay.
I'll start now. Thank you.
Let's say that
Hi,
her
I'm
name is
Dr. Chong.
Michelle. Wait a minute. Let's say that her name is Michelle, okay? 1, 2, 3,
Hi.
4.
Hi, I'm Dr. Chong. I'm one of the psychiatrists in this hospital. Could I get your name, please?
Well, I'm happy to meet you. It seems that you are Asian, and I really appreciate those who are Asians because they have the same mentality. They are very, very professional. What they are doing. So the problem is that you do not understand what I'm saying and what I'm doing. I hope that you understand what I want to say. My grandmother had a mental
Okay, I
problem
appreciate
also.
that.
Yes.
So I'm here to help you today. So could I first get your name, please?
You can call me Michelle, no problem. But the thing which I
Oh,
want to tell you
Michelle.
that I want to help the patients because my grandmother had dementia. She used to suffer because whenever she goes to the hospital, she stays too long in the waiting room, and this was very bad to her. She was suffering. And before her death, she was suffering too much because she wanted to see the doctors and she didn't have the chance.
Michelle, I do see that you seem very happy in this interview. So have you been feeling more happy than usual
Yeah,
lately?
yes, definitely, because now I'm able to help the patients. I'm able to do something in order to
And
help
when
all
did
the
all
patients.
this
Maybe this will be
happiness begin?
reflected. What?
I'm sorry to interrupt you just now. Sorry. I would just like to know when did all this happiness
Well,
begins?
it started about 3 months ago. I decided to help the patients because, I don't want them to go through all what my grandmother suffered from. I used to be with her until she died 4 months ago. After that, I decided that there's something which I can do. I have timetables for the doctors in order to make them more organized in their routines, and also I have some experience in the computer programs. I can put a program for the waiting list, which can help also the patients in order to understand the timings and also to come in
So
time.
I see that you seem to have many thoughts and goals that are is going through your mind right now. Are you able to maintain your concentration at all
Well,
recently?
yes, definitely. I'm able, but people don't understand me, so they think that I'm just doing everything and I'm not focusing. But there are a lot of things which I want to do, and there's limited time frame. So what I do is that I just do something from everything. But I know
I
that
see.
there is something to be done. I return to it back. But people say that you doing jumping from here and there. Well, I
So
know what I'm doing.
are other people able to keep up with what you are saying?
Well, definitely, I understand what they are not able to understand me. Why I hope that you will understand what I'm saying.
I see, I see. I do also see that you seem to be talking quite quickly today. Have you noticed that before? Or are you to
Good that you noticed. No, this is not my usual, but I understand that you have very precious time, and I really want you to understand everything regarding my situation because my mother and father are not able to understand it. So I have a lot of things to say to you. That's why I'm talking fast in order not to waste time. Okay, but well, doctor, is
I
it okay just to have this conversation in Starbucks or anywhere else? I'm not very comfortable in this clinic. Okay, I will invite you to this cup of tea. I understand that this might not be professional, but I prefer to continue this conversation in another place if you don't mind.
Okay, I do
Okay.
appreciate that, but I think that it would be best for us to have a continued interview here first because it would be best for us to talk here to see how I can best help you. So, do you feel full of energy lately?
Well, definitely, because there are a lot of things which I would like to do. This project, which is in my mind, is not an easy one because I'm planning to help all the patients all across the United Kingdom. So they understand
Oh,
the amount of load,
I
also
see.
of effort which I need to do. So I'm
So,
doing
do you
rotas
feel
for
like you
all
are
the all
smarter?
the hospital all over the United Kingdom.
Okay,
What?
Michelle, sorry to interrupt you. So you mentioned that you would like to help patients all over the United Kingdom. Do you see yourself smarter or more clever than other people?
Well, I'm not more clever, but definitely because what I've experienced with my grandmother makes me more motivated, and I'm
Okay,
putting a more work, and I am more interested in this particular issues. Maybe someone else is more clever, but he is not motivated as me, and he's not focusing on this particular point
okay.
to help the other
And do
patients
you
like me.
okay? And do you have any special powers compared to other
No,
people?
no, 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 no.
Okay, okay.
I'm just, but I did a lot of routes and a lot of things in this issue, which makes me have more experience. I would like to share it with you if you don't mind.
Michelle, sorry to interrupt you. I understand that you have a lot to share with me, but I would like to know a little bit more about other things first so as to best help you. So sometimes when people are high, they may hear voices that other people may not hear. Do
No,
you
no, no,
experience these symptoms?
no,
And do you,
no, no,
okay. And do you see any things that people may not see?
no, 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 no. I'm not
Okay,
crazy,
that's
doctor.
good then.
I'm not crazy.
I'm definitely not referring to that as well. But do you think there's any chance that your mind is playing any tricks to you,
One
like
minute
anyone?
remaining. No,
Okay.
no, no,
Do
no,
you think anyone can control your thought?
No, no.
Okay, that's good. That's good. And sometimes when people are high, they may also do dangerous things. Have you been engaging in any activities that may be dangerous or
Well,
risky?
not dangerous, sometimes when I feel that my mother and father are not listening to me, I just threw to the wall, I threw a mug or something at wall just to make them pay attention to what I'm saying because I want them to understand me and help me in my project.
Okay. Thank you so much for talking to me today. Is this the first time you see a psychiatrist?
Yes.
Okay. And if I tell you that you are experiencing a manic episode, that means that you are mentally unwell. How would you say that?
No, I'm totally fine. Fine. How do you feel about what you did?
Okay. Thank you so much.
How do
I
you
would
feel
like
about time? How do you feel about what you
yep.
did? It's not an
Uh,
easy station, by the way. All the manic stations are not easy because, as you can see,
I
yes.
I think this is a good practice because I feel a little bit difficult uh, to to interrupt Michelle constantly
Very
because
good,
she seems
very good. Yeah, I will come up to this point. Yeah, it is very difficult and one of the most difficult points in the stations of mania that you want to stop the patient from talking because if he does not stop, he will not have the time to assess or interrogate about anything. So there's a particular way by which you can interrupt the patient, and it is never by going through a race with the patient to talk before him and talk faster than him, as if you are headbutting and seeing who can talk faster before the other. Simply you address her by his or her name several times. For example, say Michelle. I understand that you have a lot of things to talk about. I'm wondering, does this reflect that you have a lot of thoughts in your mind? See, this is how you stop her. You don't go through a race with her or ask the question in a loud voice and a rapid manner to put your question in the mid of her stream of talking. No, stop her by addressing her name and saying, "Excuse me, Michelle, excuse me, I don't want to interrupt you again, but I would like to ask about so and so." So the first thing you say is her name, maybe once or two times enough, and then excuse her, take her permission and excuse her that you are interrupting and ask your question. Okay? It needs practice. It's not that difficult, it does not sound difficult, but it needs practice. Did you understand me, Mr. Chong? Okay, doctor, because sometimes you did the common mistake that you pose question in a loud voice and rapidly before I talk, and you think that you are taking control by this over the dialogue. No, you are not taking, you are doing you are interrupting your patient. He can be, or she can be provoked by this way.
Okay, thank you.
Okay, and this is a very important point in this particular station. Number two, as you can see, the patient is talking here and there, and if you don't interrupt the patient, you are not going to get any information from her. This is a mental state examination, so you don't expect her to say something which will help you in the management or help you in the history because it's not a history. So you should interrupt her as soon as possible, otherwise you will waste time. Okay, once you see manic patient, don't let her talk too much. She will distract you and you will be confused actually. And one of the most common problem in this station is that because the patient is talking here and there and she will distract you, they can just actually forget what are the points to be asked about in a station of mania. And that's why it is very important to have the points which should be covered in this station in the notes, should be written in the notes, and you should have an acronym for the points to be covered in order not to miss them. Let's see how you can do this station. Okay, so laptop barcode. Okay. Okay. In the mental state of the mania, as I said, comment on general behavior. She might be agitated. She might look very happy. Pay attention to this. They give the instruction to the role player to have a particular attitude to pick up the candidates who are able to comment on this general profile, and definitely those candidates will have a better score than those who do not pay attention to this. And also comment on the speech. The patient will distract you. It is important to demonstrate a good control of the consultation. Okay. Well, you went directly through the mental state assessment by picking up the cues and picking up the information, which I was elaborating. You know, the nice thing in the mania that she's elaborating symptoms. If you know how to comment on everything, you find that all the manic symptoms will be commented on without any problem. Okay, but still, you must take the complaint in a professional way. You want to know exactly when did everything started, and do you feel with time that you are more interested in this issue? Can you tell me how? She will talk about being incorporated in making timetables and so on. And you want to know before the onset. Before the onset, she passed through a difficult experience. Her grandmother passed away. Now, after taking the complaint and having this brief discussion with the role player, you understand that this is a manic patient. It is very important to have an acronym for the points which should be covered in the mania. Otherwise, you forget it. You will forget because, as you can see, the patient is distracting you. So this is my acronym: the mood, the energy, anhedonia or new interests, and thinking thoughts. You did not comment on the recent thoughts. You have here mission, abilities, confidence, sleep, and appetite. Let's see. You commented on the mood, but you did not ask me since when. Energy, you had comment new interests. You did not ask me about the new interests because you will find that this lady is having new interests related to her new target in her life. Thoughts, as I said, racing thoughts, the mission. You will find that she has a mission which is far beyond her capabilities and identity. Abilities, she has these beliefs that she has particular abilities, or she might not, but still you must ask about. Confidence, she is very confident about what she is going to do. Sleep and appetite, I don't think that you asked me about the sleep and appetite, which are very important 2 points in the mood in general, and particularly the depression, because these patients do not sleep enough. Okay, read me, doctor. In the station of mania, enough to ask about the persecution and perception. You will not have enough time to ask more about them. You don't need more than these 2 points to show that you have also covered the part of psychosis. Cognition is very important, which you ask about. Impact, coping, and risk. I wish that you asked me about this because you will find that she left everything and she is totally devoted now for what she's doing. She left her studies, though she is supposed to be a candidate of the GCSE, and she left everything. Coping, she's not taking, but risk. If you ask me about the risk, it would have been a very good thing, because if you miss the risk in this station, which you did, I don't think that you're going to pass, because risk is a very important point to be asked about in a mental state examination of a manic patient. So in this station, this girl threw things at the wall at her house. You don't know, maybe she is driving without a driving license. Maybe she took money, or she managed to bring up money somehow. She might be involved in inappropriate relations. You did not ask me about the risk, doctor. And this is a very big mistake in many. You asked me about insight, very good. And termination. If you feel from the risk that this girl is having high risk, you should terminate by saying that this girl should stay in the hospital. Okay? And definitely she is risky. Okay, so let's see the feedback of our colleagues, if there is any. Oh, I don't know what can I repeat myself? Michelle, sorry for interrupting. Yes, yeah, you can repeat what you are saying, Michelle, by saying Michelle. Sorry, but start by stopping her by her name. This is more palatable and more appropriate and will not provoke your patient, okay? Okay, so who would like to do the next station? Now that you found it helpful, Dr. Chong, please pay attention to the way you are interrupting the patient and also asking about all items of the mode and also the risk, okay? Who would like to go next?
Thank you.
Thank you so much. Who would like to go? Have we finished? Okay. I hope that you found it helpful. Okay, please. This is only a demonstration. I think all the candidates which are participating in our session here are active candidates. You can pick up any one of them to be your study partner, and this is the backbone of your preparation. It's not by reading, not by chunking the different sources, and not by attending the Zoom sessions. Just practice as much as possible. And every day, not less than 6 stations. You should be totally dedicated now to the preparation to the class. Okay, you should be totally dedicated, at least 6 stations, to make sure that you will be able to cover as much as possible or enough number of stations when you go to the class in November. Good luck. I wish to see all your names in the pass list. Bye-bye.
Thank you, Dr.